What is the most common cause of sudden death in young, healthy athletes in the United States? The answer might be surprising. It's not accidents or injuries, but a heart condition known as hypertrophic cardiomyopathy, often abbreviated as HCM. HCM is characterized by impaired left ventricular relaxation and filling due to thickened ventricular walls. This thickening often involves the interventricular septum, leading to obstruction of the left ventricular outflow tract and impaired ejection of blood. In its congenital form, known as hypertrophic obstructive cardiomyopathy or HOCM, it's inherited as an autosomal dominant trait in 50% of HOCM patients. Other causes of marked hypertrophy include hypertension and aortic stenosis. Now, it's important to note that patients with HCM may be asymptomatic. However, they may also present with syncope, dyspnea, palpitations, angina, or even sudden cardiac death. Upon examination, a sustained apical impulse, an S4 gallop, and a systolic ejection crescendo-decrescendo murmur may be revealed. This murmur increases with decreased preload, such as during a Valsalva maneuver or standing, and decreases with increased preload, like during a passive leg raise. Diagnosis of HCM is typically achieved through echocardiography, which shows an asymmetrically thickened septum and dynamic obstruction of blood flow. An ECG may show signs of left ventricular hypertrophy, and a CXR may reveal left atrial enlargement secondary to mitral regurgitation. So, how is HCM treated? Beta blockers are the initial therapy for symptomatic relief, with calcium channel blockers as second-line agents. There are also surgical options for HOCM, including dual chamber pacing, partial excision or alcohol ablation of the myocardial septum, ICD placement, and mitral valve replacement. It is crucial for patients to avoid intense athletic competition and training. To sum up, hypertrophic cardiomyopathy is a heart condition that results in a thickening of the ventricular walls, impairing the heart's ability to pump blood. While it can be asymptomatic, it can also lead to symptoms such as syncope, dyspnea, palpitations, angina, or sudden cardiac death. Echocardiography plays a pivotal role in diagnosing HCM, and treatment typically involves beta blockers, calcium channel blockers, and possibly surgical interventions. Finally, it is recommended that patients with this condition avoid intense athletic competition and training. Remember, knowledge is power. Understanding conditions like HCM can help us better take care of our health and well-being.